Medical staff service professionals are those people that work behind the scenes to bring in providers to help our patients heal.
Protecting the hospital, protecting the community by ensuring that the medical staff that are recruited and privileged at the hospital in Midland are, qualified to do so.
The Medical Staff Services Department makes sure our medical staff follows the bylaws that are set up for our medical staff. It makes sure that our medical staff that's applying to work within the hospital is applying for the right type of privileges. For example, a family medicine doctor might apply for family medicine privileges. A family medicine doctor wouldn't apply for surgical privileges. So credentialing is a big part of making sure that you have qualified professionals doing the work that they are going to do within the hospital setting on patients. So credentialing essentially is a gatekeeping tool to make sure that you're verifying people's credentials.
Credentialing plays a key role because there is a lot of in-depth follow-up on the patient or the provider's background, their history, their work history, their educational history, their continuing medical education history, and they provide a safeguard against people putting themselves out there, somebody who they're not, or someone who has possibly been sanctioned by the medical board or lost their license, or in some way had done something that we wouldn't exactly want that type of person providing care to our patients.
So payer enrollment is also an essential part of the overall credentialing process. So when we talk about credentialing, we think about credentialing within the hospital setting. So that's privileges for providers to do certain things within the hospital setting that they are allowed to do, that they're trained to do. Payer enrollment is where you go and credential the provider with certain payers, insurance companies that pay you for the work that you do. So yes, you can give them privileges to do the work, but it doesn't mean they get paid. So the payer enrollment piece is to make sure you go to each insurance company, let them know, hey, we have an ENT doctor that's going to be taking out tonsils. So you're going to see a billing code with this doctor's name on it. Make sure you know about this person. Make sure this person is in your system. That's what payer enrollment is.
When patients come to a provider, they're either in network or out of network. And so the credentialers need to make sure that the people on staff are credentialed with the insurance providers so that they're in network. That way it makes payment a lot more smooth so the hospital can function because it has the revenue to do so. Plus the patients will pay less. Their insurance will pick up more of the tab. If they're not in network, a lot of times the patient will have to pay more out of pocket.
Medical staff credentialing is an essential function for patient safety because patients are not verifying whether a doctor that's coming to their bedside in the hospital and saying that they're going to provide care for them. They're not going and saying, okay, now show me your license, show me your fellowship, show me your training. They're not doing that. They are depending on the hospital that they come to that we have made sure that the person that appears by their bedside is allowed to do what they can do. So that verification process is a patient safety essential function.
Without medical staff professionals, the hospital wouldn't run. We wouldn't have physicians who pay for our surgeries. We're a not-for-profit hospital, so we depend on all of those services that are provided by these physicians to fund the hospitals. So without them, without MSPs, there would be no physicians, there would be no allied health professionals, no advanced practice providers, and we would get no payment for these providers either, since there would be nobody to process their applications.
Medical staff professionals are the gatekeepers of patient safety.